It's August 20, Ukraine Media Center starts its operation. My name is Svetlana Cheperenko, and now we will be talking about kids' preparation to the new curriculum year from the health perspective, how it would be safe to start their education process. And joining us in the studio are Ihor Kuzin, Deputy Minister of Health, and Anastasiia, Deputy Minister of Education and Science. So the Ministry of Health has started an education campaign for the parents recently that reminds of what is important to do in preparation of the new curriculum year. And let's start a conversation with a small video, and then you will be able to proceed to the campaign coverage. Hi, my name is Yana, and I'm a third grader, and this is my video diary back to school. It's only 2 weeks left to the school, which means it's time to get prepared. I've put together a preparation plan, and now I want to share it with you. Every Tuesday and Thursday, a new video. Together, we're putting together a lunchbox, undergoing a medical examination, aligning sleep, and a lot of more interesting things. See you shortly. So Yana is a small star. Can you please tell us about this campaign, what's its goal, and what will be the format and period of the campaign? Thank you very much. Well, in fact, the preparation to the school is a very responsible process, and we do understand that under the conditions of the martial law or the full-scale invasion, we have to take care about our kids' safeties, and obviously in school, the kids are supposed to be protected. And side by side with the infrastructure changes, what the Ministry of Health is responsible for is protection of children against the contagious diseases, because they are still of threat to the school children, specifically in specific conditions, and in particular when children get together in collectives or have to walk to the bomb shelter every once in a while. So for us, the goal is to explain how to get prepared in the context of protection against contagious diseases. It's been 1 year since the changes have taken effect that were initiated by the Ministry of Health. The format of certificate was optimized, which is mandatory when children get registered with an educational institution. It's 086, quite a familiar form that was made of a number of documents before, but it's been more than a year. That is the only document that is kept with the family doctor, and it outlines the key recommendations or the condition of child preparedness to the school. So what's important to do for the parents? They need to check their children vaccination status, because we keep documenting the growth of contagious diseases among the children. Also, what we see is that in the territory of European Union, there is a quite an intense situation when it comes to the smallpox, and we see that the level of vaccination of school children against contagious diseases is still not optimal and are not in compliance with the WHO recommendations. So it's important for the children to check the vaccination status of their kids in case their vaccination was missed, to catch up with the calendar, and then to ensure the full coverage for their kids. So the goal of the campaign is to ensure preparatory measures which are of key importance for the implementation of all of the requirements in the beginning of the new curriculum year, and a couple of general recommendations about the certificate. You can get it from your family doctor. It will be in effect for 1 year, and in case of recommendations provided by the family doctor, it will outline what needs to be done so children are compliant with all of the mandatory requirements by the beginning of the new year. Thank you, Mr. Ihor, Ms. Natalia. Let's talk in detail about the certificate. So can you tell us How long does it take to get the certificate? How long does the medical examination take? What are the specific features? Well, in Bucha Center of the First Medical Aid, we have internal indicators that help us to segregate the children so we avoid crowding in the beginning of the year. We orient the parents to arrange the medical examination on the month of the child's birth. Usually the parents respond quite positively because the examination takes place without any lines, according to an appointment, in a moment that is comfortable for the parents, and we can beforehand arrange any changes that we identify in case of examination, or catch up with the vaccination calendar, or provide recommendations for preparation to school, because currently it's only 1 week left to make sure that the child's sleep is rearranged, because during summertime they could have a different schedule a little bit later. Well, when it comes to duration, it's about 20 minutes. The information is all there, and if there are any additional conditions or anything requires any corrections, I mean any indicators that are beyond referential interval, it can take a couple of consultations, but usually just 20 minutes. Well, you've mentioned that you have this system in place when a child is invited on the month of its birth. Does it really help to remove the workload from the doctors, when the parents think that they need to do everything last moment? Well, we keep working for a couple of years, so it's not only parents who are used to this procedure. We get the adults also used to it, and every child, they already know that if your birthday comes on September, you need to attend a doctor, even in case of absence of any complaints. This is what we basically try to make our community used to. And basically the people respond quite optimistically. They come, they report, and we don't have any lines to get any certificates. Thank you very much. Now let's proceed to another stage of preparation, the vaccinations, which are important to minimize the number of quarantines and the existence of quarantines in the educational institutions, because those usually shut down that have a low level of vaccination. And in this case, we can listen to our video blogger Yana, and let's launch the following video so she tells us about vaccinations.
Hello, it's again me, third grader Yana, and we came with Mom to see if I have all the vaccines. I don't like puncture, but Mom says that vaccination is my protection. At 6 years, a child has to get different vaccines that protect them from spread from common diseases. Soon there will be a lot of children here, and it will be easy to get an infection. And but right now we will take steps to prevent this. Every child in Ukraine before 16 years old has to get all the vaccination against common diseases. What if I missed my visit? It's okay. The doctor will say when it will be okay. My immunity is ready for the next school year. See you. Everybody is so serious with Yana in the background. Mr. Ihor, the infectious diseases, which are the most dangerous for the children's groups? I will probably start with measles. And by classification, it's one of the most infectious diseases. But under the condition of vaccination, out of 10 children, 10 will contract measles, and as of today, both on the territory of European Union and in Ukraine, the situation around the measles is quite high numbers of contraction. In percentage, we had 1,200 measles cases starting 2025. But if we compare it to the previous year, we had around 70. So this is quite a big, quite a significant increase in cases. And this happens, as you said, in closed groups, and when children do their classes under the condition of close communication. There are some steps that World Health Organization is recommending to undergo. Right now, we have 74% and those common diseases that are common for children, they are quite spread in the Kyiv Oblast in comparison with other oblasts. And here we should mention also the vaccination from poliomyelitis, and it is practiced all around the world. And the Ukraine, unfortunately, had an outburst of the unfortunately, poliomyelitis outburst, which was closed with the help of the WHO. However, the last outburst, it started from Transcarpathian region, and we had to implement some measures to fight it. Also, let's not forget about diphtheria, and we are not registering many cases right now. However, however, tetanus and other common diseases for children, they are still dangerous and have to be paid attention to and taken care of. In the most oblasts of the country, and in conclusion, I would like to say that the measles is the most dangerous disease as of right now, and the vaccination for it has to be done as soon as possible. It is understandable that if some children will miss this vaccination, but do not forget about it. Please do it as soon as possible. Around 85 to 88% cases of measles are very serious and are acute, and this is not a very good number, and this is what we have to take care of. Some parents are refusing to vaccinate their children from some serious infectious diseases, and when they do this, they are basically ruled by some kind of stereotypes. What are your steps towards debunking those myths? Yes, indeed. We, after going through a very difficult path of COVID, we understood that vaccination is an issue that needs a substantial discussion and conversation with this society, and right now informational campaign is working in order to educate the population about the different vaccinations and what are the particularities of different vaccines. I won't say about the religious influence on this issue. However, a big role was played by the Church of the Moscow Patriarchy, and that's why the informational materials are accessible. They are spread among all the medical workers, and we have a lot of different NGOs, like, for example, Coalition for Vaccination. This is a whole Ukraine organization that is promoting the informational materials from Ministry of Health of Ukraine included. Also, we are going to conduct informational work towards vaccination in 2026, and this is the year when the calendar of vaccination will change in Ukraine, and the system demands substantial reformation, and update of the vaccination calendar is foreseen as a means towards European integration in reality or in practice. So and it is aimed at the children coming regularly to see a doctor, but with as little as possible, punctures as possible, injections as possible. Right now, the papillomavirus for example, this concerns mostly girls of 12-year-old age, and vaccination for poliomyelitis starting 1st January 2026. Ukraine refuses from implementing the oral poliomyelitis vaccine. And we consider this the best practice from the point of view of protection of children. The vaccination is not only individual immunity; it is also about communal immunity. What about how does it implement within the school social groups? In our center, every doctor has factually they have a group in the messenger, and they are exchanging information about receival of certain vaccines, if some kind, which vaccines are better, which are critical. We also take care of the vaccines that are not included in the calendar of vaccination of Ukraine, but are also recommended. For example, papillomavirus vaccine, it already exists. However, we are not waiting for it to be obligatory. We are already implementing it. What we're mostly facing as an obstacle is that due to the combat activities due to the war, if we orient, if we check the Ministry of Health information on vaccination and statistical data, you can see that the value, the numbers there are lower than the reality. That in reality it is connected to the fact that a lot of children has left the territory of Ukraine with their parents and are now located abroad. So we are working also about towards this. We have not mentioned other common diseases. So those. I'm not sure about this particular disease. However, the red box is characteristic for a long incubation period. So the vaccination against the red box is very important to address this particular disease, the scarlet fever, is characterized by high temperature and the raspberry tongue. This is another characteristic symptom which is accompanying this disease, and that's how you know how to address doctor. So this certificate from the medical certificate for to start basically an education, to start a school year. What are the advices for the children? Because it's a serious stress, the change in schedule, pressure, and so on. What is your advice for the parents? These recommendation that we have raised today, it's not only for children, it's for everybody basically. First that we recommend is basically restore the sleep cycle, review the diet of a child, to make sure that children consume enough enough calories, enough vitamins, and also from the point of view, from the psychological point of view, parents are. We recommend to talk to children. Parents have to talk to children about what is going on. Maybe get together with all the relatives, with grandmother, grandfather. So there are no other substantial recommendations. So, Mr. Ihor, about the COVID, we have another surge, a summer surge, and some there is rumors that there will be a mask regime implemented. What can you say about it in comparison with a previous year? Well, if you look at how the COVID situation is evolving, we see basically the same situation that happens every year. The August is always the month of outbursts. It's not so that's why the next surge of disease contraction, we are observing it right now in Ukraine. It will last in accordance with the previous data until the end of September, and on average the number of the infected is quite smaller than in comparison with the previous year, and it was 8,000 this year and 26,000 last year infected. And we are talking about COVID, of course, and we don't see a significant increase of patients with difficult forms, with complications of the COVID. we are seeing a kind of light forms of COVID right now, and this is characteristic both for the European countries and for the US continent. And this is what we have to pay attention to. COVID is significantly changing, transforming the landscape of infectious diseases, and we think that that in the future some forms of COVID can lead to complication and probable hospitalization. However, the vaccination remains the main mean of fighting against it, and it is recommended to everybody. But however, it is desirable for both children and adults who are prone to adjacent related infectious diseases. Here, I'd like to add that Ukraine has accessible the vaccine that is suitable for children starting 12-year-old, and there is around 300,000 of pieces of this vaccine in Ukraine, and we already are expecting the vaccine in autumn for the children starting 6 months old, and it will be distributed also in autumn. Also 20,000 units of vaccine against flu will be arriving to Ukraine in autumn, in September, and this mostly, in the first place, this is related to the medical personnel, because they are the ones that has to vaccinate the first. In relation to COVID, we need to understand that it will keep going the same way as it was going, and more or less. And the last thing I would like to talk about a little about the strains that are circulating around. There is a lot of rumors that there's been found this or that strain in this or that region. This is about circulation. But I have to emphasize that right now in the world there is only one strain and its subforms that are circulating. It's Omicron. So Ukrainian Ministry of Health is observing the situation. We're observing what's going on in the European Union with the Omicron strain, and its subform are not substantially different from the main strain. Those subforms that are circulating right now are leading basically to the bronchial region of the chest, and other symptoms they remain the same. The high fever. It's for some patients it's a possible complications, especially if they have related diseases. So I would recommend to perceive these strains critically. And the last thing about the current quarantine, there is not a single reason in any of the oblasts of Ukraine to implement quarantine right now. However, starting September, in some of the regions, we are starting the monitoring system for the COVID monitoring situation. And some of the oblasts, of course, in case of the outburst, can implement a quarantine. Like, for example, last year, certain facilities. It was decided to close off certain facilities. Okay, maybe some of the colleagues have questions. The micro. Here, you can have the mic.
There was a hand behind. Thank you. I'm having a question. So, to what extent the incidence level of COVID has grown? And another question: what if the parents didn't get their child vaccinated? Aren't they going to be able to get the 086 certificate? Their children got a constitutionally protected right to education. Well, talking about the incidence level, it's lower 65% comparing to the previous period of the last year. When it comes to absolute numbers, 26,000 cases that were documented as of August, and 8,000 cases this year and 26,000 last year. Those are absolute figures. But when it comes to COVID and acute respiratory diseases, they are below epidemics threshold. It's identified for every oblast separately, and it's been published on a monthly basis in the website of the Public Health Center. They have all of the necessary calculations for the threshold. And now, talking about certificate and respectively the vaccinations of the children in the coming of the new curriculum year. Definitely children may have certain conditions, and then it's up to the principal either to admit a child to the school in case the epidemic situation is of no threat. In case there is certain threat, the head of an educational institution may prevent such children from attending school. That's against set forth in the relevant legislation. In that case, the child will be offered either remote mode of education or otherwise until the epidemic situation gets stabilized. This is the practice outlined by the current legislation in force, and let me explain why such restrictions that are used on a legislative level. Well, we understand that in population there will be a number of children who are not going to be able to get vaccinated due to some specific medical conditions that prevent them from vaccination. The number of such children is usually about 2 to 3%. The outburst starts when the number of unvaccinated children is at least above 5% in the population or in a class or a collective, the school collective. So again, because of the fact that those 3% will not be able to get vaccinated, some more children may have some temporary contraindications. Well, in such school, the outburst is not going to happen. If a category of children will grow who don't want to get vaccinated just because they didn't get sufficient information or were unable to find a doctor or were unable to report, or they think that it's just unimportant, they will pose a threat to themselves and to those around them as well. Those classes, those collectives, they end up in. And it's worth remembering in this case that children's infections such as measles, we are used to think that the children's diseases are lighter, but that's a mistake. Just recall the outburst of measles that we had back in 2018, 2019. A lot of children died of measles because of the consequences, because of the measles encephalitis and other conditions that were related to measles during that outburst. So it's quite a dangerous, contagious disease children need to get protected against, and such things as vaccinations are an element of protection in the school environment. Any more questions on the floor? Well, anybody? Well, then I would like to thank our guests. Let me remind you that we were talking about the preparation of the children to the next curriculum year from the medical perspective, and we are going to continue at 12 o'clock, and we are going to talk about return of the abducted Ukrainian kids as one of the steps to peace. Thank you. Stay tuned.